mass vaccination clinics where yesterday we began including children ages 5 to 11 in the vaccination program. And today we're back here and we're delighted to be joined by Pokaru, who has come on the clinic tour today so that everybody could see how kids will get vaccinated, how the plans for all of our clinics will make the experience as kid-friendly as it can possibly be. Pokaru, what did you think?
Pokeroo, pokeroo, pokeroo.
I gather for those who could translate, this is a ringing endorsement. This is a character, a few words, and so this is all good. And I can tell that Pokaru is a huge fan of the setup. And Pokaru has to leave us now, so thank you very much for joining us and giving your strong endorsement to the way these clinics have been set up. And in all seriousness, to get the Pokaru seal of approval is terrific. But what we've tried to do very hard under the leadership of Councillor Cressy, the chair of the Board of Health, who's here, and Dr. Davila, and the whole team of people from the city and from Toronto Public Health and everywhere else, is to make this as kid-friendly and fun. I mean, an experience as it possibly can be for kids. And just watching yesterday, these kids who were brave and they hardly batted an eye at the whole experience. Actually, there was one child who shed literally 1 or 2 tears. And I think in his case, it was only because there were politicians and the media present. And I'll make no further comment on that. But the experience of vaccination, because there was a distraction, because there was a bit of fun, because there was coloring materials and lollipops and all that kind of thing, I think it went very well. And hopefully that'll be an experience that repeats itself over and over again. We're happy to be here to show the public how we have prepared for kids aged 5 to 11 to get vaccinated and make sure that it is as good an experience for them as possible, fun and positive. And I want to thank all the staff from all the different organizations involved for the work that they've done to produce that result. That is why we have here superhero selfie stations, we have stickers, we have coloring materials, we have animal prints, we have superhero vaccine clinic passports at all of the city-run clinics. And I think we could see from our experience on opening day that it made a difference, and I'm sure it will continue to make a difference. The kids that got vaccinated here yesterday were the first kids in Canada, and we're proud of that, but we want to join in this great national effort to make sure that all of these kids aged 5 to 11 get vaccinated across the country. The kid content helped, and to that extent, if there are other cities or towns across the country that we could make available the electronic versions of what we did with these passports and other things, we'd be happy to do that in order to help them make their campaigns as kid-friendly as possibly could be the case. More kids will be vaccinated today, and of course, more will even more will start getting their vaccines tomorrow in our city-run clinics, in school clinics, which also start on Thursday, and in hundreds of pharmacies and doctors' offices where that effort is now underway. It's good to see that a lot of families want to get their kids vaccinated as soon as possible. More than 31,000 appointments were booked yesterday, and that is great news. It was a response that surpassed even at the beginning expectations and, of course, caused more appointments to be opened up. There are about 200,000 kids aged 5 to 11 in our city of Toronto, and we already have a huge number of kids as a result of 31,000 appointments being booked that are on track to get their first dose. And the result of that was to open up even more appointments. So we have available between now and December the 11th, 17,987 appointments. And that number is probably going down by the minute, but that's how many we have now. So there is no problem in going online or going on the telephone to book one of those appointments. And when you add it up, that will represent in the first couple of days a total of 50,000 COVID-19 vaccine appointments for kids in our 5 city-run clinics alone over the next 2.5 weeks. So just the city-run clinics, which is 5 of hundreds of clinics that will happen in schools, pharmacies that will be available, doctors' offices, and other places in the community, we have 50,000 signed up for appointments between now and the next 2 weeks, next 2.5 weeks in our very own city clinics. And so this is terrific news for the safety and well-being, first and foremost, of those kids, the safety and well-being in our collective health, but also things like keeping the schools open and trying to finally put this nasty pandemic behind us. So I want to, beyond thanking the staff and all the people that have made that possible, I want to thank the families, because they've obviously given this a lot of consideration since they heard the news that a vaccine was about to be approved. And by the way, if you think back to the fact that that approval took place last Friday, and here we are, just a few days later, with the vaccination program well underway and tens of thousands of people who've signed up to have their kids vaccinated. And I want to say to the kids, not all of them will necessarily be watching the news, but to the extent that they are, or to the extent the parents can tell them thank you, because the ones we've seen so far are brave. They're doing something that makes them superheroes, and that's really important. These vaccines are effective and they're safe. And if you want to look, you need look no further than very near to us, where millions of kids already have been safely vaccinated. And that's exactly what we're going to do here with the cooperation of kids and their families. As a reminder, there's always more information available at toronto.ca/COVID-19 or from people you rely on, whether it's your personal physician or whether it's a community health center, nurse, or anybody like that that you can get reliable information from. There's lots available, but you can turn to toronto.ca for lots of information there. Now, while the effort for kids begins, the effort for adults continues, and we are applying every bit of as much energy and determination to that campaign as we ever were. We are making sure that we deliver first, second, and third doses to those adults who haven't received any or all of those, and that means this Thursday on through the weekend, we will have 22 holiday clinics operating starting Thursday at malls, community centers, and churches, and they remain focused on residents 12 years and up in age because we still have to make progress on that front as well. The Vax the Holidays push is part of our ongoing work to have clinics and the vaccines in the community. Take the vaccines to the people because that is the way we know now best to be able to do it on a targeted basis and to reach people on almost a one-by-one basis, certainly street by street, building by building as we continue to go forward. And that's why we will be where the people are this weekend, once again, in the malls, in the churches, in the community centers, and so on. I was out with Councillor Cressy last Saturday to the Martin Grove Mall. And what was great, we were there to highlight the Vax the Holidays campaign and to see in that case how we deployed a TTC bus, one of the special buses to get people vaccinated. But what was also great was that our ambassadors were going through the mall and literally in a very kind of friendly, non-intrusive way, just chatting with people about the ease with which they could go right outside the mall and get vaccinated. And it was working. It is working. Those people, in addition to some of our wonderful medical professionals, are also able to provide reassuring information, and they take the time necessary to do that for anybody who has questions about getting vaccinated. This is important work, and it is getting us ever closer to the goal of having 90% of the eligible residents of the City of Toronto vaccinated against COVID-19. We're in a leadership position among all major cities, and this is something that we are determined to see continued so that we can bring the pandemic to an end and make sure that our city comes back stronger than ever. Now, the vaccination rate is also helping to bring some life back to the downtown. And it's a big city, and there's every part of it is important. But if you look at the contribution made to the economy, not just of Toronto, but of Canada, by the health of our downtown, the financial district, as they call it, but there's much more to it than that. It is very important that we have people comfortable and that we have people vaccinated to get back to work downtown. We need that important driver of our city's economy and the country's economy to be stronger than ever too. It's not just the big businesses, it's not just the places in the outlying parts of the city. And so increased vaccinations will help us with that as well, and getting people back to work safely in our city. So if you're not vaccinated yet, please come out to one of those mobile clinics this weekend to get vaccinated. Dr. Davila and others of our trusted medical professionals will tell you that the vaccines are safe and they are helping to protect people. And it's paying dividends to us each and every day in terms of things people are able to do safely they weren't able to do last year at this time. And if you look at the progress we're making, a great example of that is this Saturday when we kick off the Cavalcade of Lights campaign, a month-long light display in Nathan Phillips Square. Last year, the Cavalcade of Lights consisted of me. I mean, this is a frightening thought, but it was me at Nathan Phillips Square by myself with a button that I could push to turn on the Christmas tree. I will tell you, even I didn't find that too exciting, and it certainly wasn't much in the holiday spirit. But thanks to the progress we've made on vaccinations and following other public health guidelines, this year we're able to make it slightly different, not quite back to what it was before, but we're going to have a tremendous light show that adds to the lighting of the tree. The light show will have performances this Saturday from 3 until 11 p.m. These are light shows that are new features we've added, tunnels of lights the kids can go through and so on. And in the later part of the afternoon, we will indeed light up our 58-foot tall Christmas tree, which has more than 300,000 energy efficient bulbs on on it. And this will be the kickoff of a month-long family affair where we want people to come safely in families and can walk through the square. And it's less of a crowd scene, but it'll be just as much fun and just as exhilarating for the kids to see all of these glowing ice sculptures and wonderful lighting tubes the kids can go through and things like that. All of that is happening at Nathan Phillips Square, and it's all happening because people have got vaccinated and because they have put up with the pain of following all the public health guidelines for so long. Another thing to remind you of is that the Nathan Phillips Square skating rink will be open this weekend, and that's another sign that the winter holidays and the holiday season are upon us. So these are great signs of progress. These are signs that we're getting back to life and to having some fun, but we need to continue to protect that progress by making sure that we all step up to get vaccinated. That includes making arrangements to have the kids vaccinated, where we've gone to every length we possibly can to make it accessible to the kids and to their families, and to make it an experience that the kids will find as fun as possibly could be the case. And so with thanks for her sterling efforts and her team in this regard, I'd like to ask Dr. Davila, our Medical Officer of Health, to offer her remarks for today.
Thank you. Thank you, Mayor Tory, and good afternoon. Yesterday, less than 24 hours ago, the first children in Canada aged 5 to 11 received their COVID-19 vaccines in this very clinic. What an amazing moment that was. And we are looking forward to many more such amazing moments as we welcome the thousands of children who have an appointment booked at one of Toronto Public Health's 5 immunization clinics over the next 3 weeks. Our Team Toronto vaccination partners are also ready to welcome thousands of families, with many opening their clinics today. At this time, choosing vaccination is the important decision, the important health decision that a parent can make to safeguard their children's health, the health of their family, and the health of our community. Since the provincial booking system went live yesterday morning, we have seen thousands of parents make that choice. And to them, I say thank you. Toronto Public Health has worked hard to create a welcoming and supportive environment for children and their families. All of our clinic staff are knowledgeable in how to keep children comfortable during vaccination and to use the CARD system. Comfort, ask, relax, distract. A proven method with strategies to make the vaccination experience a more positive one. I can assure you your children are in good hands here with us. For parents who may still be on the fence about vaccinating their children against COVID-19, I would offer this. My colleague, Dr. Peter Jüni, Scientific Director of Ontario's COVID-19 Science Advisory Table, said this week that the COVID-19 vaccines are the most studied vaccines in the history of the world. And indeed, closer to home, Health Canada's approval of these vaccines is premised on their safety and their effectiveness. And more than 3 million children have been vaccinated in the United States so far. And while we're still learning from their experiences and getting information, thus far, there have been no major signals of concern. Over and above all this, it is so important to have your children vaccinated for multiple reasons. First, we need to protect children themselves from infection and the risk of rare complications that can arise, like multisystem inflammatory syndrome, hospitalization, or a post-COVID condition. We also need to prevent transmission of COVID-19 within households, in our schools, and especially to those who are at risk of developing serious illness. Earlier this week, the Canadian Pediatric Society, whose primary focus is on advancing the health of children and youth, released its statement on COVID-19 vaccine for children, supporting childhood vaccination. While the Society acknowledges that children who become infected with COVID-19 generally present with mild illness, they also note that some children do suffer severe outcomes and hospitalization due to COVID-19 infection. The greatest effects of the pandemic, however, have been the disruption to children's education, physical and social activities, and to their mental health. And vaccination has a role to play here too. By limiting the spread of COVID-19 through childhood vaccination, we will be able to support a safer return to all of the activities that children have missed so much since the pandemic began. Activities that contribute to our children's health and to our own health, too. If you continue to have questions about vaccination and your children, I encourage you to reach out to your family doctor or your primary care provider or pediatrician, or to take advantage of one of the physician consultation services offered by Sick Kids Hospital or the Scarborough Health Network. Talking to knowledgeable people like these is key to ensuring that you understand the benefits and risks associated with COVID-19 infection and with vaccine, so that you and your child can make an informed choice and feel secure in your decision on vaccination. And when you're ready to have your child vaccinated, if you choose to come to a Toronto Public Health Clinic, know that we will look forward to meeting you and your child and providing you with the best possible care in a welcoming environment. With that, I'll now turn it over to Lavin, and I think we're going to take some questions.
Thank you, Dr. Davila and Mayor Tory. We will now take questions from the media. As a reminder, it's one question, one follow-up. We will unmute you when it's your turn. So first up, we have Brian Passafian from Toronto Sun. Go ahead, Brian.
Yeah, good afternoon. I was hoping to ask a question of Paul Carew, but it looks like he's left. So I'll ask a question of the mayor. Since this summer, there's been a lot of talk about Toronto reaching its immunization goal of 90%. But there has been a lot of discussion about what exactly that means. What exactly will happen when the city reaches that goal? If today's press conference was, for instance, announcing that the city had reached its 90% goal, what would life look like tomorrow? Will we see a relaxation of mask rules, social distancing? What carrot is the city dangling at the end of this 90% stick?
Well, I think the question is in a way better directed for the sort of expert answer to Dr. Davila, but I'll give you the answer from my perspective as mayor. First of all, the Dr. Davila and all of the medical experts have, from the beginning, told us that when the vaccines were available, if we could achieve what seemed like an almost impossible goal of 90% at the beginning, never before achieved, never anything like this done in the time period in question or ever, that it would provide us with a degree of protection that would otherwise not be available. And when we were looking at the surges in the Delta variant, for example, I remember asking Dr. Davila almost every day at the meetings, maybe every day, what more could we be doing? And the sort of arsenal we had available to us was quite limited in terms of restrictions being placed on people, which obviously were controversial and that you'd prefer not to do. But the answer came back in any event, leaving aside all of that. Yes, people should keep wearing masks, and yes, they should avoid crowd scenes and so on. But the answer beyond that was that your top three priorities, as I've said, should be in this order: vaccinations, vaccinations, and vaccinations. And this has been proven out, so that you're doing it, yes, in some respects to promise us that we'll have better health going forward and we won't be vulnerable to this virus and to variations on it, but we're also looking at protecting the healthcare system. And the fact is that the vast majority, close to 100% of the people, the dramatically reduced number of people, by the way, who are in hospital today, are people who are not vaccinated. And so what we were really saying to people is that the promise isn't so much that you're going to suddenly have, all kinds of new rewards. The reward we will get is being able to keep the schools open, being able to keep people at their places of work, being able to continue to go to restaurants and enjoy life and sports events and things like that, and do it safely without people getting sick and putting stress on the healthcare system. Now, so Dr. Davila can speak to all that, but I'll just say for me, 90% means we've achieved that target, which was set by scientific people at a level they thought would provide us with that degree of protection. But for me, we will have to obviously look at adjusting what we're doing in terms of how many clinics and how many people are involved and so on. But I'd say let's just keep going and see if we can get the number up even higher than 90% so that we can have even more protection and even greater protection for the progress that we've made. So the morning after, I suspect that's the kind of thing you'll hear me asking Dr. Davila about, and what the benefits of that are and how we can scale back perhaps our operation, but still have an operation remain in place to get more people vaccinated. Now, maybe I'll ask her if she would address the sort of scientific part of why that number was picked and why we've been working so hard to get there.
Well, if I can, Mr. Mayor, I was just about to add, I thought you had covered the answer quite nicely. Clearly, he's been listening to the conversation we've had over the past several months. But I would further say this. Yes, we can set the target at 90%. And this is something that we've spoken about, and certainly our provincial counterparts have raised this number as well. But the goal has always been to get as many people vaccinated as is humanly possible. We have actually, I think, all had the opportunity to experience the benefit of vaccination. We are all enjoying a little more freedom and the activities that we have missed so much over the last 20 months. And I can offer this to the public, that the more we are able to ensure that the greatest proportion of the population possible that's actually getting the protective benefit of vaccine, the sooner we will be able to return to many of the activities we've missed over the last several months now. And the better off we will all be, both as individuals and as a community writ large.
One more thing I would just add, Brian. If we reach 90%, let's remember that's 90% spread across the eligible audience, which is millions of people in the city of Toronto. There will still be parts of the city where people, for a variety of reasons, have not had the same access or have not got themselves vaccinated. And to me, one of the things I would be wanting to have a discussion with Councillor Cressy and with Dr. Davila about on that morning after the day we reach 90 would be, how do we keep going, especially in those neighborhoods? Because if you look at the vulnerability to illness, and we saw this all the way through the pandemic of some of the people who live in those neighborhoods, it stands to reason that we would continue with our efforts with those areas and those groups of people beyond reaching the 90%, which is a citywide number. So I think that's an important thing to keep in mind as well.
All right, thank you. Second question is kind of as we've gone on in the pandemic, does the city have a framework in place as to when the restrictions will start to be wound down, when we'll switch from pandemic mode to learning to live with COVID mode? Is there a target or a goal set for that?
Well, it depends what you're talking about. I mean, we have, as you know, we've set our things like our indoor masking bylaws and so on to have automatic reviews taking place. And so there are dates that are already set out for that kind of thing. And I think that, for example, how we're sheltering people is the subject of a complete review that is going on right now as to what we do in the springtime in a kind of a springtime post 90% kind of environment. So I would just say to you, the answer to your question is yes. There are a variety of different things that are being planned out on the basis that we will reach a stage where we should and will change our approach. But there isn't some, thing where I can tell you there's a little booklet that's all been prepared saying, here's what life's going to look like the day after, because I'm not sure there's going to be a day after per se. But again, that's going to be a medical judgment, and we will do everything that we do as a city on every aspect of any of this based on the advice of Dr. Davila, which is the approach I've taken and Councillor Cressy has taken all the way through this. There's not been an instance you can point to where we haven't listened to the advice, asked 100 questions about it. She might say 1,000, and that's fine. That's our job to do that, but we've followed the medical advice, and I think that is why Toronto is in good stead as a city in many respects, because we've followed the medical advice and done what we thought was right within that context, and we'll continue to do that.
Next up, we have Francine Copin from The Star.
Oh, hi, good afternoon. My first question is for Dr. Davila. At a previous briefing, you said that TPH plans to ensure that clinics where children are being vaccinated are safe. There's been some problems up in Windsor. How exactly are these clinics for children being made safe? I don't think there's any school clinics open now, but in particular school clinics.
So thank you, Francine. And first and foremost, I'm terribly sorry to hear of incidents at clinics in Windsor or to hear of incidents at clinics anywhere. It seems to me that when I think about vaccination, when you think about the concept of vaccination itself, while yes, it is an act that's taken at an individual level and is one that clearly has individual protective benefits, when you think about it in its essence, it is actually ultimately, an action that's taken that not only provides that individual level benefit, but also actually provides community benefit. By protecting each one of ourselves through vaccination, we actually end up protecting everybody around us and our community writ large. So I'd like to think that those who might have some issue with it, keep that in mind and remember that it's just as much for them as it is for the individuals who are sitting or who make the trip and effort to come to one of these clinics. Without getting into details, you know, at a granular level, Francine, I would say that, you know, we have a professional group of people here who have worked very, very hard over the course of the past several weeks to ensure that we are offering, you know, a good clinical environment, so a clinically safe environment, but one that's also welcoming and fun, given that we are talking about children who are 5 to 11 years of age. We, of course, want to make sure that these environments are clinically safe as well for those who are older than that. That's absolutely key to a healthcare environment. But over and beyond that, over and above that, we also have had lots of conversations with security people. We certainly have had connections with our provincial counterparts, whether it's the Ontario Provincial Police and those who are part of the Ministry Service. We have colleagues at Toronto Police Service who offer us good advice on how to provide, you know, a secure environment. And we trust them in respect of their expertise on public safety. So I think that, you know, I can simply commend the team here. And I know our Team Toronto partners as well have had this consideration at top of mind, but all towards making sure that we're offering a good environment for people to get this important vaccine and to get us to the other side of this pandemic.
My second question revolves around consent. What is the messaging that Toronto Public Health is giving parents around the issue of consent? Do the children need their parents' consent before they're vaccinated? And how is that consent being verified?
So, Francine, I would say this, there is provincial legislation here in and around healthcare consent. And that the fundamental point here is that the individual who's actually receiving the intervention, whether it's a vaccine or any other healthcare intervention, needs to understand, you know, what is the intervention that they're participating in and what are its attendant risks and benefits so that they can make an appropriate decision. And that's something that happens between the healthcare provider and the person who's actually undergoing the treatment or the intervention. Now, in this case, when it comes to children, we expect and we encourage families to have active conversation with their children around all medical care interventions. I think this is a really important part of ensuring that people are engaging properly with their healthcare provider and taking good control of their health. So there is no singular answer. If there is one, it's that this intervention in any healthcare intervention should be done in an atmosphere where there is open conversation, such that we know that there is informed consent, understanding what is the intervention I'm participating in, why am I doing this, what are the benefits, what are the risks, because we all want to make sure that people who are partaking of vaccination really understand and really feel secure in the decision that they're making. And I know that when they hear the information and get appropriately informed, they'll recognize that vaccination is a great decision for themselves and for the whole community.
Thank you. Next up, we have Shauna Hunt. Go ahead, Shauna.
Right, this question is for the mayor. Mayor Tory, I wanted to ask about the TTC track replacement happening on Queen West. So last week, the city promised these struggling business owners that the construction would be sped up and that the street would be open as much as possible. And I'm hearing from shop owners that that's not the case. Right now, the road between Bathurst and Niagara is shut down. It's been closed for 7 days now. There's no workers or equipment on site. This is the height of the holiday shopping season, and store and restaurant owners are desperate for customers. So they're wondering, why is this long stretch of road closed if work isn't being done yet? And is this construction still on track to wrap up on schedule?
I don't have an up-to-the-minute report on whether the construction is on track. I do know from past projects of this kind that there are things like concrete curing that has to take place during the midst of these projects where it will appear there's no work being done, but in fact, there's been concrete just poured and it has to cure so that people can't be on it. And I will check and get back with respect to an up-to-date report with respect to this project. But I will say this, the project was the subject of very careful discussion with and consideration of the ways in which you could do it. And the choices came down in a bit of an oversimplification to taking a longer period of time to do it with a perhaps less disruptive or less complete closure of the road, or a shorter period of time in which we could do this with a more complete closure of the road. And by the way, the latter was picked, which was a shorter period of time during the road, which the road would be more completely closed down. And that had a significant cost to the city. But that cost was undertaken and that decision was made so that you could have the street open again so that the businesses could be fully supported as quickly as possible. And I would only say to people that I will get back with respect to the particular status today, because I'm not aware of what was going on, why people wouldn't have been working on the site. But I will say this. People should understand, as I'm sure they do, that these shops are still open. Hopefully people in the city, consistent with what we've been saying across the city, will make an extra special effort to go and shop local and dine local with those shops on Queen West, because they are confronting this reality of the construction that has to go on. You know, I mean, there's never a good time to do this construction, but this is a project that's been stretching across the city. And it is, you know, you have to keep going with these things. For years and years, the city administration postponed doing these kinds of things, whether it's water mains or streetcar track replacement, and that is not the appropriate course of action to follow. I'm very sympathetic to the situation these shops find themselves in, which is why we sped this up, accelerated it, closed the street more completely for a shorter period of time. And I think the work will be done sooner than otherwise would have been the case, still leaving time for Christmas shopping. But in the meantime, the shops are open. I trust people will go there perhaps as an extra gesture of support for those local businesses that are suffering as a result of this construction.
Okay, if I could just do a quick follow-up here. Where we are right now, it's such a ghost town on the street. Like I said, there's no construction workers, there's no equipment, there's no staging. People have actually moved some of the road closed barriers, and cars are just driving along the road anyway, even though they're not supposed to be. So that's, you know, there really is no construction happening in sight, and people are no longer following the road closures. So I guess the business owners here are just really, really want some answers as to what's going on.
Well, I think they deserve those answers, and I've undertaken to get those for you. I just don't happen to know why today there is none of that activity going on. There's always an explanation for these things, and I will find out that explanation and get it to you as soon as I can. But I will say to people, please, in the interest of safety, as much as anything else, please don't remove these signs, because they're there to protect everybody. And they're sometimes there to protect the construction work that has been done so that people don't drive on it or walk on it. I understand completely the frustration, because a lot of those very same shop owners were closed for a long period of time because of the pandemic. But we're getting this work done on an accelerated basis, quicker than normally would have been the case, at additional cost to the city, so that those businesses can be open again, traffic flowing freely sooner than would otherwise have been the case. And that is out of recognition of the fact that they need to make up this Christmas for what they didn't have last Christmas. So we're going to get ahead with that, and I will get you an explanation as to why things don't seem to be happening today.
Okay, next up we have Nicole Thompson from the Canadian Press. Nicole?
Hi. I'm wondering if you have an estimate of how many kids have been vaccinated thus far.
Yeah, so we can tell you that yesterday we know that we've done the first, and I assume we're talking about children aged 5 to 11, just to be clear. So obviously yesterday we had the real privilege and honor to provide the first 10 vaccinations to kids thus far. We are soon to open our clinic, and we'll look forward to keeping you informed as to our progress, not just ours at Toronto Public Health and our clinics, but the clinics that are being run by our partners all over the city. And, you know, by way of reminder, there are many, many partners that do make up the Team Toronto approach here when it comes to vaccinations. We've got school-based clinics coming up in the next few weeks or so. We've got pharmacies, family doctors, hospitals, a number of different venues to make sure that people have access and choices available to them that fit their lives and fit their family circumstances.
Just, I should probably give this to the numbers man, Councillor Cressy, but just, you know, I mentioned in my own remarks that we had 61,000 people. Let me just get these numbers to make sure I don't get it right. Get it wrong rather. So we had 31,000. We had 31,000 appointments booked yesterday. There was then made available a total number of appointments such that there are still 20,000 appointments available, and I suspect those will fill up because it's a steady process. And that is just for the city-run clinics, 5 of them. So that'll be a total of 50,000 between now and the early part of December. And then you add to that 230 school clinics and counting that will happen starting tomorrow. Hundreds of pharmacies that are coming on board, 100+ doctors' offices signed up so far to give these immunizations, plus the hospitals and plus our own clinics. So I think you'll find that that number, well, it's still very small today because actually none of this was really supposed to start until tomorrow, that we will be making progress fairly quickly, but we know what the number is. The number is 200,000. And as I said yesterday, you can have no other target at the beginning than to try and see if we can get every single child 5 to 11 immunized in the city of Toronto, and that's 200,000.
Follow up? Follow up, Nicole? Nicole, go ahead.
No, I'm good. Thank you.
Okay, perfect. Next up, we have Mark Douglas. Mark Douglas, can you hear us?
Hello, there we go. Oh, okay, sorry about that. I was dialed in and the phone just hung up on me there just at that very moment when you called on me. Thanks for your patience. Question for Dr. Davila. The mayor just outlined all the school clinics that will be opening soon, the healthcare partners that are going to be happening in addition to all the city-run clinics, and there's only 200,000 children 5 to 11 that need to be vaccinated. Do you think it would be possible to get all those children vaccinated in a matter of days? Because it sounds like there's going to be just so many opportunities for families to take those children in to get their doses. Could at least the first round of doses be done that quickly?
That's right, Mark. So there's a key point there. It is the first round of doses, and we're certainly doing everything we can in concert with our Team Toronto partners to make vaccine as accessible as possible. That being said, this is not something that we want to rush per se. I do think that people need to make the decisions that make sense for their families. Different venues are going to make better sense for some families than others, and that may take up a little bit of time. But we are certainly making sure that there are channels available. You've just heard the mayor say 5 city clinics, more than 200 school clinics that are going to be operated over the next few weeks in front of us, hundreds of doctors' offices, hundreds of pharmacies, hospital clinics, lots of opportunities to meet the broad range of family circumstances and the range of different children's needs throughout our city. We are absolutely looking forward to welcoming people. It was such an amazing moment yesterday, and I am really looking forward to seeing families all over Toronto to experience the real joy that we saw here yesterday with those first 10 children and their families. I would encourage people to make sure that they're taking advantage of the opportunity that's available for them now. They'll feel that sense of relief that so many of us felt when we got our own vaccinations. And they'll also feel that sense of satisfaction as we know that each vaccine brings us one step closer to the end of this pandemic.
Thank you. And Dr. Davila, another question for you. So just to go back to the goal of the 90% double dose vaccination, the city is so close to the 90% level. Now we've got this new eligibility for 5 to 11-year-olds. So there's another 200,000 human beings who need to get needles in their arms. Does that skew the numbers? Are we further away from the 90% goal now that we have more people that need to get the shot?
Well, Mark, I think if you look at it at a strictly mathematical level and we're talking about the entire city, clearly, the picture starts to change. But what doesn't change is the goal here. Our goal all the way through this entire vaccination campaign has been to bring those vaccines and successfully get as many people who are eligible to receive vaccine vaccinated. I can't say that enough. This is what has gotten us to the point that we are. This is what has allowed us to progress to this point. Let's keep going and let's work together to get us to the other side of this pandemic as soon as possible.
Okay, next up we have Adrian Gobrel. Go ahead, Adrian.
Thanks so much. Question for the medical officer of health. When it comes to what we've learned about the vaccine rollout, equity is a big one. And, we know that some parents are, you've talked about the different ways that, families can go and get their child vaccinated to try and work for each different family dynamic. Another thing that might be on parents' minds are, if my child gets vaccinated, they have a side effect. A lot of those side effects are the same as COVID symptoms. I'm going to have to take another day off of work. Is there a clear message you have for families, a clear directive you have for not just families, but perhaps for schools and principals as well? If a child has a fever over 37.2, I think is the number, or has another COVID-related symptom, which is also a symptom of the vaccine, will they have to stay home for 14 days? Will they have to go get a PCR test, or can they just wait it out and then go back to school? What's the messaging there?
Okay, so as I heard it, there were actually two questions there. First, in and around an equity approach. And I would say this, we have, over the course of the vaccination campaign, learned a lot about, the circumstances in the city and have really sought to infuse the learnings that we've had over the course of the campaign into this next stage. So a lot of the effort, in fact, a significant amount of the effort over the next few weeks is being focused specifically on those neighborhoods. We use our data. We're making sure that this is an evidence-informed response, all aimed towards getting vaccination rates as high as possible in order that the entire city benefits from a broader vaccination coverage, but recognizing that there are some neighborhoods who require a little more focus and a little more resourcing in order to get appropriate vaccination coverage. The other component here, the second question that you asked, had to do with symptomatic children in attendance at school. And very simply, I would say this. For any child who has symptoms that are consistent with a potential illness, I would ask that parents keep them at home. I think over and above trying to limit transmission, if you think that your child is actually just with symptoms related to vaccine, probably best to keep them at home. It's difficult to actually get the full benefit of learning when you're feeling under the weather, and time will tell whether in fact you have some mild symptoms related to vaccine, or whether in fact we're talking about something that is exposure to an infectious disease and maybe even COVID itself, given that we are in the midst of a pandemic. So anyone who's symptomatic, we're encouraging people to, refrain from interaction with other people so as to limit the potential spread of disease, and to continue to get vaccinated as one really very important method and the best tool, frankly, in our toolkit right now to protect us all from COVID-19 and its negative impact.
Thanks for the thoughtful answer. A follow-up question, Doctor, on the equity thread, when it comes to the number of schools and mobile vaccine pop-ups that'll be put into different communities, Toronto Public Health today was unable to say how many schools will have vaccine clinics, that number is yet to be finalized. Knowing that we've known about that this vaccine has been coming for this age group for weeks, if not months, why don't we have a firm number of schools yet in mind, and why can't we start notifying communities as of today that yes, your community will be getting a mobile clinic pop-up?
So at this point in time, we have over 200 school clinics planned to serve hundreds more schools, and this is over the course of the next few weeks. As you can well imagine, there are a number of logistic components that need to be considered, and each school has its own rhythm and cadence and has their own unique circumstances. So, at this point in time, some of these things can only be arranged, as you get closer and closer to the actual point in time. But I'm pleased to say that because these clinics have been planned, with the school communities in mind and informed by the schools and the administration, the principals, the people who actually know the students and their families. I'm quite certain that we are providing the clinics in a manner that makes sense to those who live in those communities, to the families there, so that they will be able to access vaccine to protect their children and to protect their communities.
Okay. Oh,
And Adrian, I just wanted to expand on that to give you a bit more information. So the Team Toronto Kids program has 5 pillars: clinics, education, outreach, partnerships, and equity. Equity is one of the key 5 pillars. When it comes to school-based clinics, weeks in advance of vaccine even arriving, TPH and its Team Toronto partners have planned 230 school-based clinics as a hub and spoke model to service 390 schools in those neighborhoods for 55,000 kids. The partnerships between the local hospitals, the local school boards, the local schools, and Toronto Public Health have already been put in place. And in fact, those 230 clinics for 390 schools for 55,000 kids will be taking place in the coming weeks. The first start tomorrow. And kids who go to those schools will be receiving a notice at home in advance of them, because those schools are not for the broad public. It's actually for those kids in those neighborhoods from an equity focus. And so I actually think it's the case here that perhaps Toronto is one of the only jurisdictions in the world that even before the vaccine arrived has already built an in-school equity-based clinic model. And at the end of the day, we're going to be bringing clinics across the entire city to all schools. This is just the start from an equity lens. Thanks.
okay, that's it for today, everybody. Thank you and have a great rest of your week.